It is more common than most people realize. 1 in 4 adults is affected by mental illness each year in the United States. Half of all Americans will have a mental illness in their lifetime, comprising a wide variety of conditions including depression, bipolar disorder, anxiety, eating disorders, and borderline personality disorder. Mental illness strikes people of all races, age, and socioeconomic backgrounds and is the leading cause of disability in the nation today.
Mental illness is a term we hear a lot. It's really what we refer to these days as psychiatric disorders or brain disorders, because we understand a whole lot more than we used to. These are biological conditions, they're highly heritable, they're very comparable to things like diabetes and heart disease. In this case, the organ that's affected is the brain. We know lots of words that are common in the mental illness category, things like autism in kids. In adults, major depressive disorder is very, very common. It's the most disabling condition of any medical condition in the world. Well, there's an enormous prevalence. About 1 in 5 Americans in a given year will experience a mental illness. And over a lifetime, it's almost 50%. It's very costly. It is the most costly category of any medical illness in the world, according to statistics from the National Institute of Mental Health.
Many people mistakenly associate mental illness with weakness or behavioral problems. In fact, mental illness is a medical disease just like cancer or diabetes and has the capacity to be helped or cured through medical treatment. Research shows that for 9 out of 10 people, treatment for mental illness is effective. Yet, a lack of access to quality treatment, along with the social stigma associated with mental illness, prevents many from receiving the help they so desperately need.
We know a lot about brain disorders, and we have really good treatments. We've got a lot of research, and we've demonstrated, and we know that treatment really works for these illnesses just as well as it works for lots of other medical illnesses. Trouble is, it's very often the case that people don't come for help. There's still a big stigma that surrounds mental illness. People are embarrassed and they're ashamed. They feel that's a sign of weakness. It's not clear to them that this is a brain disorder and it's a biological condition. So we really are working hard to try to counter that and help people get treatment.
At the time when I was diagnosed, there just wasn't the help I needed, and that really perpetuated kind of that stigma, and it perpetuated the fact that there weren't knowledgeable healthcare providers at the time in Houston, and so it just made me have to continue to live with my illness versus being able to manage it.
I think many people don't realize all that we have available and the progress that we have made in the past several decades in treating mental illness. People don't have awareness of how much more we understand about the brain, how much more we understand about how stress affects the brain, and what we can do about it. That there are interventions that can make lasting differences for individuals so they don't have to suffer in silence. They don't have to suffer with a sense of shame or a sense of weakness and inferiority around their difficulties, and that there's help available.
I'd say there are 2 problems. One is that there has been an image created by the old days of sanatoriums and electroshock therapy that has prevented people from really seeing this illness as any other physical illness. And then you have the second problem, there just aren't enough of these places around the country.
The Menninger Clinic in Houston, Texas understands that treatment works and saves lives. Founded in 1925, the Menninger name has become synonymous with landmark advances in the field of mental health treatment. Here, at its brand new state-of-the-art residential-style hospital, the stage is set for miracles in mind. With a goal of providing a safe, life-changing experience for its patients, the Menninger Clinic is focused on improving the cornerstones of a patient's mental health, medically, psychologically, interpersonally, and spiritually.
I think we offer a unique treatment model. If you look at the standard of care in psychiatry these days, when you're in a crisis of any sort, depressive crisis, a substance use crisis, you might go into a general psychiatric ward, get good care. But that care is often measured in terms of hours, sometimes days. We have the advantage of working with people over weeks, and that kind of advantage allows us to have people immerse themselves into a therapeutic culture, a culture where they have 24-hour nursing support, where we have a fitness center, we have a lot of things available to help support their physical health. But building on that, we have a lot of interventions to address the nature of their struggles. So psychotherapy and group therapy, family work, to try to really tackle the crisis that led them here, to understand what led up to that.
At the Menninger Clinic, it is believed that a longer treatment period gives patients a chance to truly recover and a better opportunity to initiate lasting change. As a result, treatment stays at Menninger last 4 to 8 weeks as compared to 3 to 7 days in a typical acute mental health unit.
Many people have complex disorders, maybe depression, an underlying personality disorder, substance use on top of that. You need time to sort it out. We do believe that when patients have enough time, I tell families it's like learning a second language. You can't do it quickly, you have to work at it and you have to practice. But then you get to a place where you then can keep the benefits that you've gained, take them home with you, and stay better.
When I came to Menninger, I needed residential care. The outpatient treatment, something I had tried for years and it wasn't working for me. So it's definitely what I needed and what helped me. If I wasn't living here and immersed in the treatment, I wouldn't have seen the results and the success that I did. And of course, it changed my life. Menninger helped me understand what my illness was and how I could successfully manage it. And I think finally finding a place where doctors knew what they were doing, they knew how to provide the treatment I needed and knew how to teach me the tools I would need to continue treatment on my own. Even when I left the clinic, just made a difference no one else had been able to make.
As a world leader in psychiatric treatment, research, and professional education, Menninger is continually at the forefront of providing the highest quality patient-centered care. The recently expanded Professionals in Crisis program is just one example of the clinic's commitment to reducing mental health stigmas, especially among business executives in high-performance fields such as medicine, law, and education, among others.
One of the things that we tackle first and foremost for our professionals is addressing the stigma around coming in for help, which is, I think, an issue a lot of professionals struggle with, in the sense of, I'm used to being the person who kind of handles things and manages it, and I can't believe that I couldn't manage this on my own. So we help them reframe and rethink that. That's one thing we do. The second thing we do, and I think this really keeps us on the forefront of mental health treatment today, is we offer people the advantage of time. We spend weeks with them, getting to know them in depth, the nature of the stressors and difficulties that led them here, and then really work on how they can make changes that last. I think the problem with short-term treatments is it helps stabilize people, but doesn't necessarily help them institute changes and practice new behavior that lasts.
Statistics show mental health conditions are on the rise. The Menninger Clinic plans to stay abreast of the challenges that will pose and to continue to be the name that comes to mind when people consider mental health treatment. With a strong focus on research collaboration with Baylor College of Medicine, the Menninger Clinic's vision is to be a place where ideas, science, and clinical care merge in order to transform the lives of its patients and the global community at large.
Not only is mental illness very prevalent, it's increasing in this country and throughout the world. And we want to make the best treatment available to as many people as possible. We'd like to make that clear in terms of the treatment we do here at Menninger. We're doing outcome studies, we're studying people with standardized data collection, we're following them after they leave, and we have a new protocol that's a translational research study that we're doing collaboratively with our basic scientists at Baylor College of Medicine, where we're looking at our clinical data and combining that with brain imaging data and genomics data so that we can look at genetic risk factors, what the brain looks like under brain imaging, and how that correlates with the kinds of illnesses our patients have. We hope this will inform us about the best treatment for selected patients who really need this. And then get on a soapbox and help insurance companies understand that if they'll pay for this kind of treatment for the right patients, it'll be cost effective in the long run.
From my perspective, what you've got is this wonderful combination with Baylor, and Baylor is a global institution. They have operations in various places in Africa, etc. And so what you get is Menninger is tied into that psychiatric capability. And Menninger itself is world-renowned, and so you get patients both coming from overseas, as well as you get doctors publishing or other professions, therapy professions, that are publishing in journals that are globally consumed. And so I think there's a fabulous platform when you get together with a first-rate medical school in a big city like Houston to actually spread the gospel on these illnesses and how you treat them.
They are in a very unique position to be the voice for what I don't call patients, but I call them clients. You know, 3 of whom are our kids, and as a result, living fruitful, normal lives and pursuing their passions and their dreams. I think if Menninger can create a model, be a model for other cities like this, you might see some dramatic change.
The Menninger Clinic, advancing treatment, transforming lives. To find out more, please visit menningerclinic.com or call the number on your screen.